From the White House to the classroom, mental health is becoming more of a priority. Unfortunately, it's sobering statistics that have amplified its importance. For example, since the start of the pandemic, there has been a 25% increase in pediatric emergency room admissions for mental health reasons and a 30% increase in adolescent eating disorders. Numbers Congresswoman Kathy Manning is hoping to tackle in new legislation. She's introducing the Improving Mental Health and Wellness in Schools Act. The goal is to teach kids the importance of taking care of not just their physical health, but mental stability as well. There's also funding in this to increase the number of mental health professionals available to students while they're in school. She says she's seen the impact the pandemic has had firsthand and heard from both parents and teachers alike on the need for this.
There's been a lot of emotional and mental stress, and those are real issues. They need to be addressed. It's okay to talk about it, and we need to make sure that our students feel comfortable talking about it and feel comfortable asking for help when they need it.
Now, social media plays an important role in this too. Jaren Doby, an outpatient mental health therapist with Novant Health, says parents need to teach kids to mind their social media manners, but also they need to set boundaries for content and screen time.
Folks, you're not alone in what it is that you may be dealing with, whether you are on the parental side or whether you are a student or a young child that is dealing with any kind of issues, whether it is online or in person. Not to diminish anyone's feelings, but to really normalize the fact that, more people are experiencing these kinds of things, especially online.
If you're a parent, here are some important warning signs that something could be wrong. Look for changes in sleep patterns, appetite, mood, or behavior. That could even be that they're happier than normal, giving away items, engagement, or lack thereof. And the good news in all of this, Doby says this younger generation is actually more likely to report their feelings and seek help. So that Gen Z, they're really all about mental health. So that's the one positive in this. But it is really sad to see those numbers that, the number of suicide, those rates going up among this age group.
I think it's really important that they're actually putting money towards it, right? It's one thing to say, hey, we're going to help and we're going to do this, but when you put money towards it, that means that bodies can actually be put in positions to actually be there with the kids instead of just saying, well, we're just going to focus on it.
And it's a shame that we've had to see some of these crazy things happen in schools for this to happen. I mean, we know that school districts everywhere are dealing with money issues. And so maybe some of the support staff were some of the things to go back in the day. Well, now they realize they need some of those positions back and some of those mental health resources for kids who could really use it.
I mean, think about it. Your kids spend more time at school with these people than they do at home during the week. They need to have these resources available for kids and know that it's okay to talk about mental health and it's okay to not be okay.
Right. And one counselor for 300 kids is not enough.
Nope.
You can't know all those kids and be able to help encourage them on a daily basis like that.
All right, well, let's hope they get some more help that they need.